wrinkles. The older you get, the deeper they get, and it can be more than a minor annoyance. Well, if you have wrinkles on your forehead or around your eyes that just won't go away, there's a new medical procedure that some plastic surgeons are touting as a solution. It's called Botox. Let's check it out.
Botox is a medication that, used in the proper dose, will weaken or paralyze muscles that can cause wrinkles. It's a very effective cosmetic tool because you can get rid of wrinkles between the eyes, you can get rid of forehead wrinkles, and sometimes some around the eyes. Botox is very safe. It's been around for more than 12 years. You may think of Botox as a poison. It does come from botulism toxin, but it takes more than 5,000 times that dose to make somebody sick.
I'm hoping that Botox will smooth out this line right between my eyes, because nothing else in my face really bothers me, but it seems like if you notice anything, you notice that. I'll be curious to see what happens. I can't really imagine how something as deep as the lines between my eyes can be smoothed out so easily.
So all my life, I always use my forehead and my eyebrows when I'm talking. And as I got older, I started to realize that when I stopped talking, the lines were still in my forehead. So Botox seemed like a good way to try and alleviate those constant wrinkles in my forehead, which you can probably see right now.
I had Botox a couple of months ago, and the results were rather miraculous for me. About 3 or 4 months after that experience, you begin to see that the Botox is wearing off. The lines do remain still pretty relaxed after that point, much better than before, but I just felt it was time to come back and have another Botox injection.
My big concern is that by relaxing my forehead, I'll lose some of my expressiveness and personality. But Dr. Loeb assures me that my personality will shine through and I'll just look younger with a smoother forehead. So I'm willing to give it a try.
Now let's check out our 3 Botox patients 1 month later. Here's Robin Cohen before she had the injection in her eyes. And here is how she looks 1 month later. Looking good there, Robin. Now here we have another example for you. What you're about to see is what Linda Hayes looked like before visiting Dr. Loeb. And here is how she looks today, 1 month after the injection in her furrowed brow. And now live and in person in our studio is patient David Rosenbaum and plastic surgeon Dr. Thomas Loeb. Welcome to both of you.
Thank you.
David, you really had an expressive face, didn't you?
That's right.
And look how smooth it looks now. Well, why did you have it done? And we're going to look at a before and after, too. Okay, it's coming up, but you can go ahead. Mm-hmm.
The opportunity presented itself. I had heard about Botox, and I thought I would give it a try.
Okay, there you are before.
Right.
Because you're animated. You
use my forehead a lot when I talked.
Now look at the difference.
Right. All smoothed out.
Wow, that's
Now show them how you can still raise up your eyebrows.
What Dr. Loeb did was he didn't go all the way down, so I can still lift my eyebrows. You can see there's probably little lines up here at the top. But these deep lines at the top aren't there anymore. So I can still express myself, I can still smile and raise my eyebrows, but my forehead doesn't look like an accordion anymore.
Well, how does it feel, though?
It feels fine. The first couple of days, it felt different, a little numb. And I had to sort of get used to the fact that I couldn't use those muscles anymore. And actually, I'm finding now that I'm able to recruit a little bit of those muscles. So slowly,